When we're suturing an incision, we have a lot of different options here. In all cases, we want to fill the incision with a absorbent powder or something that of the sufficient value to prevent any fluids from exiting that wound or incision or medical device hole. And then we're going to follow that by some Padco cotton. Just taking some Padco cotton and we're going to stuff it in there. And that's going to prevent any of that powder from coming out. It's going to also act as an absorbent to prevent any fluid from coming out, give it something as a barrier. Now, on one end of our needle, and we have many needles, we're going to we'll put our needle on. And then on the other end, we're going to tie a knot. Now, depending on how thin the skin is, how easily it is going to come through, sometimes just one simple knot will do. But if we need a bigger knot in our string, and this is very common, what we're going to do is we're actually just going to loop it around a few times. Create what I like to think of as a beehive. So by doing that, and it's okay if we have a tail, there's nothing wrong with having this tail on here, but you can see how big the knot is compared to if I had just looped it once. If I had looped it once, I would have had a thin knot that could potentially come through some very thin skin. Now, we have various sizes and types of needles. We have the S-shaped needle, which is very common to our field as a suture needle. And it's great because you can see a little grip there, a little friction, but it gives you the ability to scoop underneath the skin, which is perfect for the type of sutures that we tend to use. Now, the way we use this is almost like you're the Beast in Beauty and the Beast trying to drink soup. Okay, it's not glamorous, but it does give you this kind of scoop, spoon-like figure. We have much bigger S-shaped needles, medium. Okay, so we have, but right here I have 4 sizes of just S-shaped needles. I'm going to use the smallest one for this incision, but any of them would be perfect. If we're suturing a large incision going down the abdomen, then the biggest of those needles is the appropriate one. We also have C-shaped needles. These C-shaped needles allow us to get underneath something. We make a much sharper turn in the skin than, say, an S-shaped, where I have to make this handle also has to pass through the skin. So when I come through, I'm also working that under and somewhat twisting that needle in order to get out. Whereas this, I can make a much sharper turn and come right out of a much closer area of skin where I have to get close and I have to go around something. I maybe have to go around a bone, maybe I'm trying to make it in and do a hidden suture underneath the skin and going from piece to piece, and that much tighter turn is not possible with the S-shaped needle. Now, I also have much smaller C-shaped needles. Same thing. I can make a much closer turn. So in this case, with the incision that I have, I'm going to use this much smaller one to make much closer turns on the inside, because I don't really have a big incision here. And this big one, if I go in, is going to come out much too further away. I'm not going to get enough sutures in this to hold it shut due to its size. In a much larger incision, I may be able to pull that one off. So I'm going to use the small one if I were to do a inner suture in here where it's hidden. Now, we also have this hockey puck sickle shaped needle as well. And then this one, same thing. It gives you that much closer, but it gives you a longer handle to play with, so that way you're not really close to it. I can get in and I can make a much closer turn, but then I can pull straight out from this handle. So it really depends on preference, part of it. The other part prefers on your dexterity, has a lot to play with this. But the other part of this is your ability to get the suture that you're trying for. So we're going to use this small S-shaped, and they do get smaller than this. This is not the smallest S-shaped needle available. These are just the ones that I have with me today. Now, we also have various types of ligatures, various types of suture thread. Now, in our field, we tend to use what really looks like twine or thread. It's nothing fancy. It's not similar to what is in the hospital, but we do use similar to regular suture threads as well. We can use anything. If you really need something durable, tough, and thin, we can go for dental floss. Dental floss does an amazing job. It's really thin. It's great for the cosmetic sutures. And I'm going to use some black thread. You can see that it's not thick, but it's fairly thick. We need thick to hold together because we do have a lot of tension taking place in many of the areas that we're pulling together. We have this wider white one. So you can see that it's actually thin and long. So again, depends on what we're trying to accomplish. I have very durable, much thinner off-white colored. I have a much whiter color, and this is really, really thin. And this is more of a cord than anything else. And same thing, I have this yellowish one. Now this one is wax coated just like dental floss is. So again, dental floss has the same thing. This wax coated would prevent it from getting wet, from deteriorating. Gives it a nice durable form in order to work. Now again, we have a nut on one end, suture needle on the other. Now you could potentially, if I wanted to, and there's benefits and there's disadvantages to this as well, but I could double it up, and I could tie this all together, and now I have a double thread. Now the advantage to this is sometimes you need that extra width. The disadvantages to this is that means I'm going to see twice as much thread coming through. It's going to be twice as thick, and that means my suture is going to be harder to wax over. It's going to be much more visible. So with this, a single thread is going to be much thinner. It's going to be not as noticeable. And the other thing with a double is as it comes out, you're playing with both sides. So as it comes out, you might get one side longer than the other. You might get pieces that are kind of kinked up around that around that incision that aren't as glamorous or as pretty. So we're gonna, for right now, we're gonna do a single. We're just gonna go with one. Now we don't need to bring this all the way back. We just need enough of a tail, but the longer our tail is here, the more it's gonna get stuck inside here as we have to kind of play with it to get it out. So the shorter your tail is, the better, but again, we want it long enough that we're not losing it as we pull through. We don't lose it through the eye of the needle. So what we're going to do is we could go away from ourselves or we could go towards ourselves. There's, again, benefits and disadvantages to both. So the benefit to going away from yourself is that as you suture, you can get about halfway. You can tuck cotton in, you can tuck in the absorbent powders, and then suture the rest of the way, especially on something like an arm or a leg where maybe that stuff is falling out. You have a part of the face where it's falling out. But in most cases, if you can get everything tucked away inside and it's not going to fall out, you're going to get a much better suture pulling towards yourself than going away. And the reason for that is because you have that tension. You're able to pull. It's harder to go away, but if you're pulling towards yourself, we have that tension and we're able to keep this string, this ligature, very tight. Now, one big difference between the living and the dead is that with the living, they're going to clot. They're not, even if they're bleeding right now, they're going to eventually stop. The problem with the dead is that they no longer have the clotting factors that the living do, and therefore we have to counteract that with absorbent powder and cotton. But we also have to have a nice tight suture. If our suture is loose, we're going to see leaking. So really a tight suture is a very, very important factor in what we do. So what I'm going to do is I'm going to start at the point. We have a very clean incision here. We have a very clean edges that can pull together easily, but wide enough to create some tension to demonstrate this for you. You want to be able to pull those sides together. So I'm going to start at the point. I'm going to start from the inside, and I'm just going to come right out. Okay. Now I don't want to put my finger near that needle. I want to protect myself because as I do, I could stab myself. So as we come out, we want to pull through. Now you can pull your needle through, and that knot is going to get stuck. Now you notice the tail is going to get left inside the incision, and that is perfect. Okay, so this doesn't matter how long I have of a tail. Now this is a two-handed procedure here. You're going to use both hands equally, but keep the needle in your dominant hand. I'm right-handed, so I'm going to put this in my right hand. And as we go down, I'm going to pull through. Again, you notice that my hand is not near that needle. I keep this hand way up here, and I keep it, and I'm pulling tension on that ligature, which is going to be more important as we go along, so you're going to see that. So as I pull this needle through, what I want to make sure is that I'm on this side of the existing ligature. If I was in here, you can see that this would loop around and create a knot, and that's not what I'm trying to go for here. So as I pull through, I'm pulling tension on this, and as I pull through, I'm going to now switch my hand over to this one. So now as I switch my hand over, I'm going to pull tension, and I'm going to, same thing, now go on the other side. And I'm just going to go across. Now in this case I lost my needle off, and that's fine, I can just put it right back on. So real bodies don't pull up as much as my sponge here does, but by pulling up on this, I'm going to open up this edge. Now right now we have a very easy incision to get to the inside, and that was intentional for demonstration purposes. But a lot of times this incision, the skin is going to be closer together, and to get inside you have a lip. To get there is not going to be as easy, and to push up and get your needle through that edge is also not going to be all that easy. Since you have loose skin, it's going to take some effort to push through, and that's where we always see someone take their fingers and they're pushing through like this because they're trying to push tension down in order to accomplish that. Again, dangerous. We don't want to put our fingers near the needle. So if you pull up on your ligature, what you're going to find is that you're going to tent that skin up, and you're going to pull tension. It's going to be nice and taut, and it's going to make it a lot easier for you to get your needle in. So again, we're going to go right along. We don't have to be fancy about this. And again, I'm going to let go. I'm going to just go side to side as we go along. Oops. And again, my sponge does inhibit the fact that the sponge does move as I'm doing this, whereas a real person, you have something to pull against, which is nice. Oops. We're also going to try to keep the sutures as uniform as we go along as possible. This is going to give us a nice clean incision. If you keep it towards the edge, then you're going to, along every side, you're going to have a nice uniform mix. If you go further out, then you're going to have a nice uniform mix. Much bigger lumps as you go along, but uniform. If you have one on the outside, one closer to the inside, that could potentially cause a very ununiform suture, and that very ununiform suture is going to potentially be very hard to wax and could leak. So we want to have some uniformity as we go along. So as you can see here, now it's harder to get in and get that as the incision is much closer. So now holding this up, now while holding this up, because it's easier to see while it's not in the vise, I've made a nice clean suture going all the way down. You can see at some points where I was closer to the edge and further away, and you can see that it's at points a nice clean suture, and other points maybe it's not as pretty or uniform. So that way you can see the difference. But now we're at the end. It looks like we're at the end, doesn't it? But if we start looking at that skin, you can see that there's still part of the sponge showing. You can see the pink on the inside of that sponge. So we actually have 2 more sutures to do, even though it looks like we're there. We want to make sure we get the whole way, because if we don't, again, we're going to see a leak. So again, we're working away with 2 hands. We wouldn't be holding the individual up and doing this one-handedly like I'm doing at the moment. I'm doing this for demonstration purposes. So, but you can see that I managed to get 2 more sutures just from the inside of that incision without any issue. Now, how do we finish the suture? We're going to finish this by coming from, we're on this side, so we have to go over to the other side. And while we're doing this, let me lock this in, so that way we can see this easily. So what we're actually going to do is we're going to work our way from this side. We're not inside the incision. We're on the outside of it. And I'm going to come over, and I'm going to, again, the way that this needle works is that I have this scoop-like shape, which means I can take it, I can hold it, and when I hold the handle, and as I apply down, the needle comes right out, no problem. And this is why in our field we love these S-shaped needles, is because they have this feature to get underneath and pop right out the other side. So again, be careful. Don't stab yourself, and pull that needle almost all the way through. Now, we're going to see this loop here. Before we get that far, I'm going to sneak this through. Now, one thing is always make sure you have enough ligature, have enough string. Because if we don't have enough suture thread, ligature, we're now going to be at the end, and you're trying to get a little stub, and you're trying to work its way through. And if you do get to that point, then what you do is you put your needle through the loop at the end, get it almost all the way through, and then get your then put the thread through the eye of the needle, because now you don't have to try to get the whole length of the needle through that loop, and you can just try to get, now you just have to get that little piece through. But that's a little trick for that. But in any case, make sure you have enough thread. You don't want to have to be doing that. You'd rather cut some thread. It doesn't cost that much. Just to cut a little bit of thread off at the end is perfectly fine. Because we're going to want to make sure, I'm going to show you in a minute why we need so much thread. This is how we're going to hide the end of this, what we call the wick. So, same thing, I'm going to go through, again, I usually wouldn't be holding this, but you could hold way back here. I don't have a big hand to hold, skin area to hold here, so I could pull back on the skin and give some tension if I needed to. But same thing, I'm going to scoop this through, and I'm going to pop right out through the skin. So, pulling that through, oops, so you can see that it comes off easily. So, in that case, what we're going to do is we'll just put this right back on without any issue. Again, so now you can see that I'm getting closer to not being able to get through that loop there. So you can see how easily that can happen. But I'm going to pull through, and we're going to create a second knot. Those are called half hitches. So what we're going to do is we're going to have not one but 2 half hitches to keep that in place. We don't want this all to come undone, especially due to the tension that does exist in this area. And we want to make sure that we have enough thread in that area in order to we want to make sure we have enough thread in this area to get through and hide the wick. So what we're going to do is we're going to actually put the needle in here, and we're going to come out somewhere up here. So what that's going to do is I have a wick. Now if this could start untying on us, this could therefore become an issue. This could get tangled in something. So by hiding that, we're going to do ourselves a big favor. So what I'm going to do is I'm going to see the whole length of this needle. How far can I go? And I can try my best to get it between the existing suture so I don't create extra holes that I don't need to have here. So I'm going to pull that through, and you can see that I just came out here. Now I have this extra string. All I have to do is pull extra tension. You can see how I'm going to pull it. Bunches up a little bit. I'm going to cut it. Boom. And it sucked itself right back in to within the skin area, and it's hidden. We have a nice clean incision. So from this, you don't see a wick on either side. You see a nice double half hitch. We have 2 half hitches here, and those 2 half hitches are these 2 half hitches are going to allow us again to keep everything in place. It doesn't move because it's nice knots, but then again we hid that wick on the inside. We just tailed it back, and we came out, we pulled it out, we pulled some tension, we snipped it, and when we let go, whoop, that ligature went right back into the skin. So let's show you another suture. We have what we refer to as the purse string suture. So a purse string suture is necessary in the cases where we have a hole, something that's something to this effect. Now, what it's going to so now with a hole, if we were to suture this, we could bunch up, especially a big hole, we could bunch that up fairly quick, and when we bunch it up, it just doesn't look natural. It starts pulling things. Elongated sutures, you want to do a worm suture. So what we have here is considered a baseball suture, or a worm suture, or a continuous stitch, continuous suture. What we're going to do on this side is what we refer to as a purse string suture. So now that's not the perfect round hole, but it does get the gist. So this could be from a trocar opening. This could be from a, as you're going along, maybe you made a bigger hole than you intended, the skin stretched. Maybe we have a colostomy opening or tracheotomy opening in the neck. Maybe we have medical tubes. Could be a lot of different things. So in this case, maybe the vaginal or the anal orifices are stretched out to a point where plugging them isn't an option, and you do have to suture that. And same thing here, you can suture down and put a trocar button into the trocar opening or any of the other openings that I mentioned, and by using a purse string suture, you can shrink that down around so that it actually fits the trocar opening. So what we're going to do is we're actually going to work our way around. So just like those little penny pouches you may have had as a kid, or think of a drawstring pants, like sweatpants. So now I want to draw your attention to that there is no knot on this end of the string. So I'm not going to pull it all the way through, and this is intentional. Okay, so I'm going to leave a little bit of that there. We're just going to go down and up, and we're going to work our way around the opening here. And by working our way around, and my sponge ripped, but do keep in mind that this does happen with real life too. Skin rips all the time. Okay. So, and we don't have to be fancy about it. We just have to get around it. So again, we do have skin ripping all the time. We get a lot of people with very thin skin. They don't have to be old to have thin skin. So, as we work our way around, we're going to come out at that point. I can take my needle off and put that away so I don't stab myself. And now we have two strings coming out, and as you can see, we have the thread going around that incision. Now if I take both parts of this and I were to pull, so what we're going to do is I'm actually going to put this into the vise so that I can hold on to this. Okay, so what we're going to do is we're going to actually pull the two strings opposite from where they are, and you can see how I shrunk that round opening down right away. Now, again, in many of my lectures and demonstrations, I show you that having one loop, right, so all we did was just loop it once. By looping it once, I do that, but it loosens itself. That doesn't keep anything loose. Right now I have a sponge in the vice grips, right now I have the sponge in my vise here. So it's not going to go anywhere. But in real life, and if I were to take this out of the vise, that would loosen. So by taking this, what I can do is I can make sure that it doesn't go anywhere by looping it more than once. So I'm just going to throw this tail through a few times. I'm going to throw this tail through. 1, 2, 3. So I just looped it around 3 times. And by pulling that tight, and this is a good trick again when you're doing the bow on your Christmas presents as well. You don't have to have someone try to tie it and then try to hold their finger as you tie it, and as soon as you get that bow and they remove their finger, it still loosens. This is how you get it to not loosen. So as you see, I did that. And then now, again, always do a double knot. Don't rely on that. So now I just tie this. So now I just do my second knot there and keep it going. The other thing I'm going to tie it a second time. Now, this may not be easiest thing for you to see, but I want to make sure that what I tie is that the top resembles what we refer to as a square knot, not a granny knot. And what I mean by that is I have to go this way around the loop, because if I went around and went this way, that side's going to have a shape that I'm about to show you separate. Whereas if I were to go this way, the knot's not going to line up. So what I'm going to do is I will do that correctly first, and we will show you on the other end of the string what that looks like. So the difference between how a knot stays together is all in which side things go on. So you can see I have my black thread and my white thread. So if I were to tie this side, I'm going to loop it around, and you can see the difference between the two. And then if I were to tie this and put this white piece in here, you can see that it doesn't line up, right? This white piece goes this way, and it's not on the same side as this white piece. That's going to make a knot, and it will stay for the time being, but it's not going to stay for the long term. It's not making a very clean knot. Okay, so what we're going to do is I'm going to undo that last part, leave the first part, and when I do it, I want to make sure that when I loop the thread around, I'm going to loop it in. Now you can see that the black part and the white part are together. Can you see that? How it's Now we got 2 loops inside of each other. And there's a couple different ways, of course, you can tie this. You can get really fancy if you play with your knots here. But by doing that, I have 2 loops inside of each other. So the same thing is taking place down here. When I tied it, I tied the first one, and then if the second one, if the threads line up like this on top of each other when they're tight, you're going to have a much better knot that's not going to come undone. If it's going the other way and I have the strings on opposite sides of this, I don't have a nice knot. We call that a granny knot. If it's like this, we call it a square knot, and if it's the other way, we call it a granny knot. If it's independent like this in the middle of a rope, down here we don't use that terminology because it's not technically that way, but it's the same figure and it's the same appearance and the same structure as tying it like this. So the other knot that we can do is interdermal, and we can hide our knot inside of underneath the skin. We don't want to make it hidden. So same thing, I'm going to loop this a few times around as opposed to just once, and this will prevent it from ripping through. A small knot can come right through the opening. Remember, your needle is bigger than the string, so we got to keep that in mind that we just created a opening. It doesn't look that big, but again, you need enough of an anchor to prevent it from coming through. So what we're going to do is actually work from side to side, but from the inside of this. Okay, so working away from myself in this case is going to be a lot easier than working towards myself. But again, you can go in either direction. I just find it easier to do this than to try to come towards myself. When I'm doing the baseball stitch, I'd find it much easier to come towards myself and I get a much tighter suture. So I'm just going to go from the inside, and again, using the C shape, I can make a much tighter curve within. I'm going to tuck that in, and same thing, I'm just going to go side to side. Now there's a couple ways you could do this. You could keep backtracking, or you can come back and forth, so it depends. What I'm going to do is I'm going to backtrack, but not all the way, because I don't want to lose this space here. That's very important to have that. So we don't want to lose any of the thing. Otherwise, I'm not going to have a very tight suture. Oops. So again, muscles rip, skin rips, as you can see I just did with the sponge there. So it's going to, and we want to make nice tight turns, because we don't want to have this go further out and then as a result it's not. So again, things do rip. The sponge will rip through in this case, so we want to keep that in mind, that we have to be very careful not to rip through by pulling too much tension. The skin's a lot tougher than what's underneath, so we have to be gentle with this. And we want to make sure that we get enough within the grip of the needle that we have something to pull on without it ripping. Because if you go too shallow, it's going to rip because there's just too much tension on that. So sometimes you might have to tighten things up a little bit later, but what we can do is, just to show you the suture, again, we have to go fairly deep in order to have that. Now this should be a two-hand procedure as well. This is not as easy on the sponge as a person that has the body weight to not move, but you can see how I'm pulling that together. Always be careful that you don't prick yourself or stab yourself with the needle. That's very easy to do when you're working. And as you notice, I'm back stepping. I'm starting back here because otherwise if I moved forward it wouldn't necessarily give me I'd be done and without enough stitches in there to hold this all together. But you can see in there, you can see the back and forth as I start here, I go back, and you can worm it. You could do it in a lot of different ways. It depends on the size of the incision and how much space. In this case, I have something very small, so I have to backtrack a little bit in order to make it work. We don't use this suture as nearly as much as we do a suture that goes through the skin for simple reasons of it doesn't hold as, much, and most times we can wax things through. But a good time for a suture like this would be if we are trying to hide that suture on a very visible area. Very cosmetic based, and you can see I just ripped right through the sponge again. Again, it just shows that this is the same thing as what happens when you're working with skin. It rips through easily. So you got to just find another place. Go a little deeper, and again, you can see the sutures within that area. So what you can see here is that the further down I go, the more that the skin is still going to be open. The closer I get to that skin, the more closed up I can make this incision. So you kind of have to play with this. You can also do a suture like this to try to keep muscles together. Maybe there's pieces of the body that are separating. In a restorative situation, you're going to have to suture, you're going to have to tie together bones, you're going to have to suture together muscles, and you can work your way up and suture something completely underneath, suturing the muscles, and then that way it keeps the body formed, because your body is designed, or is looked at in a way where there's muscle. If there's no muscle, your body doesn't look good, because your muscle and your bone are what gives your body shape and structure, not your skin. Your skin just covers it. So we need to be able to suture together those muscles, keep them where they belong, and that's going to give the body structure. Sometimes you have to pad that or fill that with cotton or other materials, PVC piping, in order to give that structure as well. So in this case, we can try to end this by looping it around, or we can try to, if we now have a hidden spot here, we can end it the same way we did before. But again, so you can see if I go in the skin area as opposed to down below, I'm going to show you how much better of a suture we can get. So you can see how much tighter it gets if we go towards the, if we go into the skin just below within that layer, we have a nice hidden suture. So you can see that as we get closer to the skin, we're not down as far in the muscle and fascia there. As we get closer to the skin, we get a much cleaner hidden suture. You can also see how much easier that would be to wax. You can see how that could be hidden, how we could kind of disguise that as a wrinkle a lot easier than a baseball suture would be. Now we could finish the suture the same way that we would finish any other one, or we can try to do it within the suture as well. In this case, I'm just going to finish it on the outside. And that gives me one less place I have to wax. I can just worry about waxing this one little area. Or maybe this part of it's hidden, but the other part isn't. So we can do our best to kind of hide this. So I'm just going to make the 2 half hitches. Doesn't matter if you go on either side. You could do the first one here and then the second one on this side, or the second one on this on the inner side. It really doesn't matter, as long as you have two half hitches. Same thing. I'm going to loop it. Just put it right through the loop, and that's going to create a knot. So, and you always want to go from the same direction. If I went in this way and came out this way, I want to, for the second knot, I want to go in this side and come out this side the second time around as well and go through the loop. Otherwise, one actually almost unties the other, makes it loose, because you're going in two different directions. So you want to make sure you always go in the same direction when you're doing this. If you have a really tough incision that you have to close, you could actually do this the whole way along, and that would be considered a locking suture. So one method would be to lock it every so often. So one, you do a few sutures on the outside or the inside, either one, and then you lock it. Do a few, lock it. Do a few, lock it. And you could do that where you just make an outside knot every so often. And again, when we're dealing with, it would be the same thing as this. I can suture, but if I'm finding that I have a lot of tension in this, instead of just having the knot here, I'm sewing along. All right, I have a lot of tension. I'm really trying to keep this incision closed. Let's say you have an abdomen where the intestines are sticking out. Then I can make two little knots, 2 half hitches that will keep it, and then I just keep suturing. Get to a certain point, maybe 5, 10 stitches away, same thing. 2 half hitches, lock it in place, and then keep going. And then same thing, end with your 2 half hitches at the end. So what we'll do is we're going to end this one the same way we end all of them. We're going to go through, and we're going to try to poke through as far as our needle can go. Now if we want to get further, I could easily just put a longer needle on right now, and I could go much further down the incision before I pop out. So what I'm trying to do is work it so I can come out through as close as I can to where that incision is. I don't want to make holes where I don't need to. So same thing. I'm just going to pull this tight and take my needle off. And then same thing. By pulling tension on this, when I snip it, once that comes back, you're going to see that that works itself right back in to where it was, and it's going to hide. So these are our major sutures. Again, we have our worm, continuous, or baseball suture. That's this one. And we have our hidden suture. Now, how you do that on the inside, there's a couple different methods. And you're going to want to refer to your textbook. You can see some diagrams. But again, hidden suture, more exposed suture, baseball is our traditional way to go. In either case, you end it with 2 half hitches. Trail that tail back into the skin and try to come out through the incision as far as you can. Again, if you need to put a longer needle on, put a longer needle on. Pull some tension, snip that thread, that wick, and it's going to sink right back in. It's going to hide it. The longer that wick is, the less likely it's going to be to untie because you have a lot of give to work with. If you're having trouble with something, or you potentially know that something is going to loosen, again, suture along, make 2 half hitches, to just keep everything, lock everything in place at that point. And part of that is going to reduce the tension that you have to work with going forward. If I have a lot of tension and I'm working, and all of a sudden I have a point that's loose here because of the tension, that means this is all going to loosen. So if I lock it in place, I'm locking it as of that point. Now if I go along and it loosens here, I now have to just tighten up this point. It's not going to loosen this other part of that. I just have to tighten up what I have up to that point. Then go 5, 10 stitches, lock it again. If you don't have a lot of tension, you can make it the entire incision length and just knot it at the end, and you don't need to do a locking suture. If you have a really difficult suture, you can lock every single one of them. Lock, 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 and each one of them is a half hitch. You go along, do a half hitch, go through the skin again, do a half hitch, and each and every one of them is a half hitch as it goes along. Not a running suture, but a half hitch, which is a lot more closer to what you'd see as stitches in the hospital. It's not exactly. Stitches in a hospital are a different type of stitch, not one that we commonly do in mortuary practice, but you could, but it's not one we commonly do. But with that, you're still doing a running suture, whereas the hospital does a knot. They take two ends, they pull it through, and they do a very specific knot. Then they cut it, they move on, they do it. And that's why they count how many stitches you do have. Well, I had one, and that's independent. They do running stitches in healthcare as well, but not as common and not as frequently like we do. I hope this video helped you. Please click the icon in the lower right-hand corner of your video screen to subscribe to get more videos just like this.